All right. Good afternoon, everyone, and welcome to our Valentine's Day presentation, our Wellness webinar. So my name is Donna Gunkel, and I am the Director of Clinical Integration, sitting in for Kamal today. So I will be your hostess. And if you would like to go ahead and share your slides for us, Ern. All right. So, like I mentioned, today we will be presenting the Diabetes Program Wellness webinar. And just to introduce the program team, so as I mentioned, Kamal Erkin is our chairman of the ACO and is usually the host of this webinar. We also have Dr. Rapu Hundal, who is our program director. He's one of the endocrinologists here in our ACO network. We also have Roxana Portlock and Carla Williams, our licensed medical social workers who support our programs, and Caroline Webber, who is with us here today, is also our lead dietitian with the webinars. So we do this on a monthly basis. Typically, it is the second Friday of each month, and we have a different presenter each month. We pull from some of the specialists within our network. We have our endocrinologist, cardiologist, nephrologist, podiatrist, etc., that join us to talk about different topics and how they may impact your journey with diabetes. So today, as I mentioned, we have two of our dietitians. So we have Caroline here, and also with us today we have Ern Lau. So both of them treat our patients throughout the network in individual sessions. And so if we move on to the next one, our topic today is Step Up for Your Health. So today we're going to talk about exercise and diabetes, and we're going to make it simple for you. So I will go ahead and turn it over now to Ern.
Thanks, Donna. All right, so we know that exercise is one of the many ways to manage blood sugars, and we're always told this, but how does it work? So we always hear that exercise has an insulin-like effect on our blood sugars. When we exercise, we utilize our muscles and we cause them to contract with movements like running and squats and things like that. These muscle contractions actually trigger an increase in insulin sensitivity and insulin responsiveness. Essentially, it increases the effectiveness of how insulin can lower our blood sugars. The more sciencey answer to this is that exercise really increases the glucose transporters that work alongside insulin in your muscles to kind of carry glucose from your bloodstream into your cells to use as energy. So overall, we're able to tolerate higher blood glucose and we bring it down a lot quicker. Unfortunately, this effect is not permanent. If not, if that was the case, none of us would have to work out long term. But we tend to see that they are short lived, about 24 hours after your workout in some degree. So we generally recommend, of course, a consistent exercise routine so that you can consistently reap the benefits of regulating your blood sugars in this way. Donna, you're muted.
Sorry
Good.
about that. So I was just going to say, so as a patient, and I know you guys see patients throughout your day, we know that it can be difficult to decide, right, on what might be best and the best thing to eat before a workout. So maybe you could give us some examples on some of the foods that we should look to eat prior to exercising.
Yeah, absolutely. So before I go into examples, which I think Caroline will walk us through, I just want to say also that carbohydrates are the body's main source of energy, and we store carbohydrates as muscle glycogen in our muscles so that they're really accessible right for our workout or any activity that we are doing. Now, because it's a main source of the workout, it also is depleted pretty quickly. So the general rule of thumb is that we want to get carbohydrates in before a workout, and then after a workout, we want some sort of combination of carbohydrates and protein. Now, during our workouts, we're utilizing our muscles and we often see little micro tears in our muscles, which sounds really scary, but it's very common and it's necessary to allow the muscle to adapt and grow after. That's how we get stronger and fitter and able to kind of tolerate more over time. After our workout, we want that protein in our snack to help repair muscles. And then we need the carbs as well to replenish what we've utilized in terms of our muscle glycogen stores. So Caroline, can you walk us through some examples of some pre-workout snacks to really fuel our workouts?
Absolutely. I feel like a lot of the time we're really afraid of carbs and diabetes, but because we're moving our body, right, we're going to utilize those carbohydrates. So some of the favorites are just quick digesting carbs. We've got fruit here. Fruit is fantastic, right? You're going to digest that. It's got some fiber in it, but it's still going to kind of raise that blood sugar a little bit. So keeping an eye on the blood sugar, we'll talk about in a little bit. But we want to go primarily with that carb base, like a granola bar. It's got some great complex carbs that we want to have. So we want to also include maybe dried fruit is a great one to bring with you if you're on the go. So very quick digesting, like Ern said, within that 30-minute time period before a workout. But if a workout you're seeing is probably like in between meal times, you're not feeling too hungry, maybe like 1 to 2 hours before a workout, you're going to eat something like maybe a whole grain piece of toast with some almond butter, peanut butter, a granola, Greek yogurt is great because you've got a little bit of protein, a little bit of carbohydrate there. So you're kind of, as we go farther and farther from exercise, are going to build a more sustainable snack rather than just focusing on that carb by itself. A great one I love is like a hummus and cracker, something nice and light. Even some crackers and cottage cheese is a great one because you got a little protein, a little bit of fat, but you also have that carb source. Now, if you're going for a longer intensity workout, right, you're going to be working out for longer than an hour. It is important that you're going to fuel your body well. You want to make sure that you've got a good combination, carb, fat, protein, because it's going to digest slower, give you more sustainable energy because you're using those quick carbs in the immediate, but you need something of reserve to pull from for a longer duration workout. So having a protein and a fat, like we see with oats and peanut butter, we've got that carb in the oats and peanut butter and has the protein and the fat. We've got a nice balance of like a yogurt parfait where we've got probably maybe like a lower sugar yogurt, which you could talk about for blood sugar control. A little bit of granola, a little bit of fruits for a little extra fiber and carb. My favorite is like a nice avocado toast with a little egg on it because you've got that protein, you've got that carb, you've got that fat. That's a great little stacking, if you will, for a nice rounded snack. Even just like a nice wrap if you're on the go, if you're getting lunch, something nice and light. The key is light because you are going to be working out. So you don't want anything that's going to like slosh around or just make you feel tired. Like if you carb load before, like eat a big plate of pasta before, you're going to probably feel pretty sluggish for that duration of the exercise. So it's super important to kind of pick, the time frame in which you're going to eat based on when you're going to exercise. Closer to the exercise, you want that carbohydrate as quick fuel. The farther you get away from that exercise and the longer you're going to exercise, you're going to want something more sustainable with kind of multiple options of a carb, a fat, and a protein.
So we've talked about some of the foods you should eat and a little bit about the time frame, but putting it maybe into simpler terms, is there a specific time we should consider eating? And does that depend on the workout? So am I gonna always have my snack 30 minutes before, or like what's my time frame?
Yeah. So again, to re-emphasize what Caroline was saying, carbs need to be easily digestible because they're our main source of energy, and so they have to be really readily available for the body to use. Generally, we recommend 30 to 60 minutes prior to a workout. That's like a really good time frame to have a specifically carb-forward snack. Now, this in numbers to like the snack options that Caroline provided us generally is about 30 grams of carbohydrates before an hour-long workout. Anything more than an hour, so closer to like an hour and a half, 2 hour range, like if you were to go for a long run or a half marathon or anything longer than that, that will require more carbs as you are working out. So we generally say after that 90-minute window, every 30 minutes, you will have another 30 grams of carbs. And so some runners or people like that would have like gels and, little gummies to kind of carry with them to fuel them for their workout. After your workout, we talked about that combination of carb and protein. And so generally, numerically, that's going to be about 30 grams of carbs after, plus about 20 to 25 grams of protein just in pairing. Caroline mentioned we don't want a high fat high protein option prior to your workout because it's going to make you fairly sluggish and sick and it's going to feel like a brick in your stomach. The reason behind this is that fat and protein are the two food groups that take a lot longer to digest. And so it really is going to sit in there and keep you full for a longer period of time. If it happens that you are having a full meal with fat and protein, prior to a workout, we say have it 2 hours prior to a workout. And you should be okay in terms of digestion and feeling good for your workout. Caroline, any post-workout snack ideas?
We love a combination I have on here is like a full meal, right? So say you would go to the gym, you'd work out and you go home and have dinner, right? We see that here with the salmon, maybe a little bit of rice, avocado, and some greens. We got that protein, fat, and carb and a little bit of fiber thrown into there for that sustainability. But there's also some things I really love in here. I call them adult Lunchables or like little snackables because we're obviously on the quick, we obviously have quick schedules and we're busy and we want something quick and convenient, but without a whole lot of prep. So these are things you can bring with you. You can keep on hand at home. So I love Sargento snack packs because they have the carb, fat, protein. They've got that cheese, the nut, the dried fruit for a little bit of that carb. And then there are also other things you could make at home. We have like the hummus plate and the pita, even a protein shake and some fruit. We're having some pairing. So always trying to find that friend, as we call it, for your carb, where it's going to help with that blood sugar sustainability, because we know your blood sugar is going to kind of ebb and flow, and you have to know your specific patterns, right, to eat in a way that balances your blood sugar. But these are just some great ideas, like a cottage cheese and crackers, a meat stick and an apple, right? You've got a little bit of everything going on, and it doesn't have to be complicated. It doesn't have to be like some expensive supplement that you get online. It can truly just be whole foods that you eat that can help meet those needs.
All right. Thank you, Caroline. So Ern, can you elaborate for us a little bit on what would be considered a high impact workout versus a low impact workout?
Yeah, absolutely. So high impact workouts traditionally are a little bit more explosive, sort of jumping style workouts that place a lot of impact essentially on your joints. So this would look like the HIIT style workouts that are really popular, or your high intensity interval training, or running and jumping workouts. These workouts are also often very cardio heavy, just because they tend to be big movements and they jack your heart rate up. However, it's not necessarily suitable for everybody and can often cause injuries, which is our main concern if somebody is not conditioned for this sort of workout, or not used to this style of workout. And if they were to jump head first in, that can be really dangerous. So low impact workouts are great because they can be equally challenging, and often move you through the same range of motion as your high impact workout, just less impact on your joints. So examples of this would be like Pilates and yoga, resistance bands workouts, where you're still challenging and placing resistance on the muscles. And all of this count then towards strength training, which is great because we want to use that big muscle groups to kind of improve blood glucose control. And so we generally recommend a combination of both styles, so cardio and strength. I always tell patients, please do not feel like you are doing any less if you're unable to participate fully in high impact workouts, but aim for a movement that generally feels really good for you.
Right. Thank you. So I know we've talked a lot about what we should eat before and after, but what about how much, right? Because sometimes it's easy to say, eat this, but how do I know how much of that I want to eat?
And that's a good question because it is a little difficult when you put like 30 grams of carb. Like, what is that? Like, it can be hard to kind of dictate like the amount of carbohydrate you want to eat with other, how much protein do I eat? How much, vegetable-based fiber do I eat? So it's important to have something, talk with your provider and your dietitian about what specific amounts right for you based on how much time you're going to work out, how frequently you're going to work out, your individual health goals. And so, Ern, I know you have some good recommendations on types of physical activity, and what's the recommendation on how much you should exercise?
Yeah. So the American Diabetes Association recommends about 150 minutes of some sort of moderate aerobic activity a week. Anything that sort of gets your heart rate up to a moderate pace. I generally tell patients, hey, if you're able to have a conversation and still be a little bit out of breath, that's a good place to be for a moderate pace. You don't necessarily have to be, dying and not being able to get a single word out during your workout. You can break this down into 30-minute sessions about 5 times a week or however works for you, right? So that's the cardiovascular recommendations of the American Diabetes Association. In terms of resistance exercise or strength exercise, they recommend 2 to 3 times a week on non-consecutive days. That's important because our muscles get sore, and we don't want you to get injured, because what happens when we're sore is that most of the time our form goes, or your risk of injury kind of goes up. Strength training does not only mean having to lift heavy weights in the gym. Again, any kind of resistance that we're placing on our muscles to sort of challenge them really counts. So yoga, Pilates, the slower movements that are controlled body weight exercises, chair exercises, bands, all of those count. So here I have a sample week based on those recommendations where I've placed our cardiovascular activity on Monday, Wednesdays, Fridays, and then Tuesdays and Thursdays are strength days. So again, see that they're not in consecutive days so that you give your body a rest. Examples of cardio can be something as simple as going on a 30-minute walk during your lunch break. You could go on a 30-minute bike, whether it's outdoors or if you have a stationary bike or a recumbent bike at home. You could do something as simple as a walking low impact cardio video at home in the comfort of your own living room. You could do a HIIT style workout if that is more your style and that you are capable and you're not going to hurt yourself doing it. For strength, you could do a 20-30 minute yoga, Pilates, or chair exercise routine. You could use resistance bands or weights in the gym and do more like a rep style workout where you're focusing on different body groups. So upper body, lower body, and core, and again, spreading those out adequately. Or you could just use your body weight and, do squats, push-ups, and again, work through a good routine for yourself. I get this question a lot with how daunting exercise can be and where and how do I start with exercise. The goal is to try to move the body more throughout the day. That's the main goal. Just because a lot of us work desk jobs and we're sitting for anywhere between 8 to 10 to 12 hours in the day, it's generally pretty sedentary throughout the day, and we're trying to break that up. So a really nice way to start, especially when we're thinking of like taking advantage of that blood glucose control after a meal, is I always say, hey, try to get moving within the hour after your meal for about 10 to 15 minutes, because we know that our sugars sort of climb after a meal because we've eaten and we've had carbs, and that's okay. But help the body with kind of bringing your sugars down after a meal. This is a really nice way of doing it. And if you're doing this 3 times a day, you are breaking up that sedentariness throughout the day. So again, we are trying to encourage moving the large muscle groups. Some people do squats or sit and stands at their desk chair, every hour, every 2 hours throughout the day. The idea is to build a routine. You build up to 30 minutes a day, you build up to a few times a week, and then you work up to a combination of that strength and cardio. We want to challenge the muscles with the strength training, and then we want to get your heart real nice and healthy and strong with your cardiovascular training. This is a PSA. Please never work out on an empty stomach. Never do fasted workouts. It is not recommended for anybody, whether or not you are diabetic, but especially if you are diabetic, because the risk of low blood sugars or hypoglycemia is extremely high. Naturally, exercise brings your sugars down, and if you're starting at an empty stomach, the chances of your sugars dropping at a really quick rate is high. We don't want you to pass out in the middle of your workout. We don't want you to have to drive home and feel like you're going to pass out on that drive back. It is definitely more of a safety protocol, but it's not worth the risk. If it's been more than 2 hours since your last meal, please have a snack and use one of the examples that we talked about earlier. And always check your blood sugars before and after a workout so that you know where you are with that. And we also always say, hey, pack a snack with you to the gym, just in case you feel a little woozy. You have something there to kind of help with that. And of course, we know that, blood sugar kind of moves during and after your movement. Caroline, would you be able to elaborate on like what we would do if, we have lows or highs that happen in the middle of our workout routine?
Absolutely, because this is not only just for workout, but if you have a low in general, we want to make sure it's a danger situation, right? So it's safety. We want to make sure you have a 15-gram carbohydrate snack because we do something called the 15-15 rule, where you consume 15 grams of simple carbohydrate, quick digesting sugars, no protein, no fat, carb only. And we consume that and wait 15 minutes, and then we want to see it rise. If it's not in a safe range within those 15 minutes, you're going to repeat that carb intake. And we want, like I said, quick digesting carbs. So these are some good options to keep on hand because they're portable. And you want to make sure you always have one, right? So especially if you're prone to lows, but if you're going into physical activity and you're kind of learning what your ranges are doing during the day, fruit, great. Quick banana, right? You've got that. Smarties are great ones. Like this little, like one single packet, I think is about 15 grams. Glucose tabs and glucose gel. You can find them at most pharmacies. I think these are great to keep in your bag because you can travel through airport security and all those things with them. So it's very helpful to keep those kind of tucked away. Even a juice box or like regular 4 ounce of juice. The key is with these 15 grams of carbohydrate is sometimes we get nervous and scared and we overdo it. So the key is knowing what your specific blood sugar does, how much carbohydrate it takes to bring when you're having low to bring it up to a good range. So that's the kind of playing with it that you need to know about yourself and checking your sugars regularly. Because if you overdo it and drink the whole juice box, you might get a high. So we want to make sure you have a certain controlled amount of carbohydrate. Check those sugars regularly. Make sure you're in a safe environment, right? Sit down. Don't force yourself to keep going or keep moving. There are some other quick options on here, like a little applesauce pouch or honey sticks are great. You would need probably about 3 or 4 honey sticks because I think one is about 3 to 4 grams of carbohydrate each. A regular sugar Gatorade in the small amounts are great as well because just stick it in your bag for when you need it. And then dried fruit as well. So like 2 to 3 dates would get you to about 15 grams of carbohydrates as well. So preventing lows, we want to prevent it by eating before a workout. But sometimes, especially if we're taking insulin and things like that, we could have a quick blood sugar tank. So you want to just be prepared when you can. Now, there are some people who do experience what we call like a blood sugar spike during exercise because some forms of exercise can actually release, glucose raising hormones like adrenaline. So we want to be prepared for that as well. And this comes to knowing your numbers and knowing your specific blood sugar ranges. There are some strategies to prevent your blood sugar from kind of spiking too high during a workout. And it could be to choose moderate intensity aerobic workouts or circuit training with light weights and high repetition. We often see those high adrenaline spikes in like weightlifting and really high intensity workouts. So we want to make sure that you're doing the best exercise for yourself to prevent, blood sugar spikes. Practicing even relaxation techniques of like deep breathing, visualization in those moments when you notice your blood sugar is spiking, you can feel free to kind of take a seat, drink some water, relax a little bit in between sets if you're doing kind of weightlifting techniques. Even moving your workout to later in the day, there are even the phenomenon, it's called the dawn phenomena, where in the morning, anywhere from 4 to 8 a.m., your blood sugar will spike just because adrenaline and cortisol hormones are higher in the morning. So if you're more prone to that dawn effect, being able to move that exercise to later in the day gives you a better chance of a more stable blood sugar as well. And talking to your doctor, especially if you are taking certain types of insulin, short-acting medications, making sure you let your doctor know your specific trends of I exercise this much, this is what my blood sugar is doing. Do I need to change anything medication-wise if I'm going to, keep this up? And then also avoid eating excess carbohydrates, right? Overdoing the carbs, of course, like if you're going to eat 60 grams of carbs and not do a whole lot of movement, of course, we're going to see a little bit of a blood sugar spike there. Exercise is helpful. It's not the magic fix, right, for a high blood sugar, but it is helpful. So we want to make sure that it's a very kind of controlled, calculated amount of eating a certain amount to fuel you, but not overdo it. But we also know that, knowing your numbers is going to be the most important part because the patterns matter. So managing the levels with any form of exercise is going to be possible once you kind of understand those personal patterns for yourself.
So I know, like a lot of patients, right, our goal is always to meet those recommended guidelines for exercise. But the other thing is we also want to manage our health, manage our blood sugar. But what if we're struggling with that motivation to exercise?
My favorite. I love talking about this. I talk about this every day in all counseling because we want to make sure we have something that's sustainable, right? We want to create goals that make sense, that are realistic. If I'm not a runner and I say I'm going to go run 2 miles, like that might work for a day, but then I hurt the next day and you don't keep it up. So the pattern and consistency is not going to do you any good. So we talk a lot about creating SMART goals, right? With specific, measurable, achievable, relevant, time bound. Having those specific things picked out for your goal, like on Fridays at 4 p.m., I'm going to go to the gym and exercise for 20 minutes on the bike, and I'm going to keep that up for the next month. That is very specific. And the more specific you are, the more intention is behind that goal. And so it's not about perfection. It's about creating a routine that you feel like you can stick to. It can be walking in place. I personally just restarted my fitness journey, and it's me 10 minutes in front of my screen doing an at-home workout that feels sustainable to me right now. And so that is something that means, okay, we're going to see progress in the future. It might not be a lot now, but action comes before motivation, right? Put the shoes on, put the outfit on. Maybe you're going to walk outside. Okay. So put your sunglasses on. Having that action can actually push you closer to that motivation, and starting with building that goal confidence over time by just easing into it rather than going full force of I'm going to the gym every day, which if you can, fabulous, that's great. But starting small is really what's going to build the goal confidence and kind of snowball into that consistency and routine. Really just about showing up, not about showing up 100% every day, but you showing up for that 5-minute walk, for taking the time to do a 10-minute workout online, or going to the gym for an hour if you really love it, and doing something you love. That's the best part of it, because you have to enjoy it in order to keep consistent with it. I also know, so I mentioned the at-home workouts. Ern, I know you have like a lot of really good resources for this, because I know what I really love to do at home, but especially for beginners and all varying levels of difficulty. Can you elaborate more on kind of resources and recommendations? Like, do you need extras equipment? Can you do it at home by yourself?
Yeah, no, absolutely. And I really delved into this during COVID, actually. I always say one of the best things that happened out of the pandemic was that all of the exercise classes that you would have had to pay a lot of money for prior to COVID were then free during COVID, because YouTube was such a good free resource, and everybody was stuck at home doing home workouts. So an excellent free resource, especially for visual learners. So if you're a beginner and you need to, anybody can look up an exercise routine online, but knowing how the motions are and like having a trainer there giving you cues to breathe, to kind of tighten your core and all of that is all helpful. One, for the exercise, but two, for safety, because again, we don't want you to hurt yourself. So these are some of my favorites, and also Caroline's favorites. We kind of talked about it.
Love
And
them.
these are the ones that I personally use as well, like 2 to 3 times a week at home as part of my routine. And so we've broken it up into some chair exercises. And so if you are not too comfortable being on your feet for the entirety of like a workout routine, these are some fantastic options. I will say, get a chair that has handles, like seat armrests. That's what I mean, not handles, armrests on the sides, because that's going to help make sure that if you have to catch yourself or anything like that, that's a safety thing. And then make sure it's on a non-slip surface in the middle of your living room. I love these because you can put it up on any screen, right? It could be your phone, it could be a tablet. Everybody has a smart TV now, and you don't need a lot of space. So you could do this in, a small space. You just need a yoga mat, or a towel if you have carpet down. You can do it in an apartment. And so you can really tailor it to what you need by adding like little terms in the search bar in YouTube, where you could do no equipment. I don't have any equipment at home, so I'm going to do no equipment, which means it's going to be a body weight workout. It could be no jumping for a low impact workout. Or even if you put in low impact, high impact, the way that the exercises and like all these videos have sort of evolved over time, it's just really tailored to everybody, and they range from 15 minutes if that's all you have. Again, like what Caroline said, showing up on a daily basis. Not everybody has the mental capacity or the time to do, a 30 to an hour, 2-hour workout every day. So if you have 15 minutes, there are 15-minute options, 20, and of course up to like the longer, 40 minutes to an hour, whatever feels good for you. So we have chair exercises and then yoga and Pilates. I love Move with Nicole. I do her workouts religiously 2 times a week. And then the body weight strength and cardio on the right are more a combination of things. Again, whatever you need. And have a lot of fun. You will find your favorite resource and you enjoy the way they cue you, the way they talk to you, and the way they motivate you. That's a really
They're
important
very
part of all of this.
encouraging.
They are really
Very
encouraging. Some of
encouraging.
them don't talk as much. So it just depends on
Oh,
what you.
yeah. Grow with
I
Joe.
personally don't
I
like
did that
getting yelled
today.
at.
So I Grow with Joe is a really great one that I do frequently. And it's just it doesn't even feel like exercise because you're just kind of like you're just like moving your body. Sometimes it feels like I'm just like flailing my arms, but it's still movement. Like my heart rate gets up. It's great. And even you just start to feel like there's small differences like that's not as hard today as it was yesterday. And so you start to build that's the goal confidence that we're talking about. Like I can do this for longer. So they're really, really, really great resources.
Yeah, I really like these. Yeah.
Well, thank you for that information. Hopefully that's helpful, not only these, but right, we've also provided other key terms that we can put in the search to get other options. But we've kind of talked a lot today about fueling for our workout. And I've been hearing a lot about electrolyte replacement. So could one of you give us a little bit more information about electrolyte replacement, perhaps after those workouts?
Absolutely. Yeah, so electrolyte replacement is important, right? For most exercises, if we're sweating a lot, we really use electrolyte replacement if we have increased sweating, we're not hydrating enough, if there's a lot of heat. It's basically going to replace the vitamins, minerals that you might be losing during a workout, like sodium and potassium and those types of things. So really, electrolyte replacement is really only important in those high impact activities that are lasting a little bit longer than an hour. For most exercises, you could just drink water and eat a balanced snack and you should be fine. Or like say you're doing the workout in the sunshine and it's really hot or you haven't consumed enough water today, maybe that electrolyte replacement is going to be helpful for you. They do come in a lot of shapes and sizes, so it's important to know what you're looking for when you want them. Like Gatorade Zero or regular Gatorade, right? That has a different amount of minerals than something like Liquid IV, compared to Nectar, compared to Noon. So having your intention in mind, there is one out there called like Elementi, as it's spelled, very high in sodium. Ern and I were just talking about this recently. If you are watching your blood pressure, you do not want that one because it's got 1,000 milligrams of sodium in it. So knowing your intention, reading your label, just because it says electrolyte replacement, what are you really looking for? Is it just like a kind of distribution of sodium, potassium, all those things? Or do you just want some kind of like just rehydration purposes? Usually Gatorade is a good option if you just want a simple light rehydration beverage. But we also know that some of these are full sugar and they could raise your blood sugar. So read your labels and look for the zero sugar if you are dealing with highs. But if you deal with lows during exercise, all of these, I think actually Liquid IV and Gatorade come in the full sugar. So you would want to carry that with you and maybe have a sugar-free option if your sugars are stable. But knowing that the full sugar is going to raise your blood sugar pretty quickly because it's just kind of quick sugar. So summary wise, you really don't need an electrolyte replacement unless you are heavily sweating, do a high intensity workout or a very long workout. And or like if you're out in the heat and things like that, it's beneficial, but you can just, hydrate with regular water, eat a snack, for just short workouts like our 10 to 30-minute workout we just like would do in our home. You don't necessarily need electrolyte replacement for that.
All right. Well, thank you for that additional information there. So are there any final comments, thoughts? You did mention right now a little bit about water, so I don't know if we want to talk a little bit about drinking water during our workout, right? And or before or after, if you wanted to comment on that a little bit.
Since I covered, this, I'll touch on water because water is important. Your body is composed of it. Everything in your body functions off water, so you need it. It differs for every person, right? Our minimum we usually say is about 48 ounces. Then maybe 48 to 64 is our nice little happy range, but anything above 64 is really great too. The key with water, because you can drink too much water, is spreading out the intake. because you don't want a lot of water really fast because that's not going to make you feel great. Water toxicity, we don't want that. But I'd say an average recommendation for person to person would be anywhere from 48 to 64 plus ounces of water per day. And during the workout, I would say how much you sweat is kind of what you would compare it to. If you're not sweating a lot, sure, like drink a water bottle of like 16.9 ounces and you should be okay. But if you're dripping a lot, you should be kind of rehydrating as much as you're sweating. So you should, especially if it's in the heat too, or if you feel like you're just more tired and you feel like you haven't hydrated enough during the day, you should bump up that hydration during the workout as well. Erin, do you have any additional thoughts on that?
A really easy way of kind of gauging your hydration is the color of your urine. And I know everybody's like, oh, it's like super clear. We don't actually want clear, because that can be a sign of overhydration. We want it a light lemonade color. And so wherever you're, like Caroline said, we have general recommendations, but it depends on how well your body holds hydration, how much you lose, how much you sweat, and all of that. And so gauging that off your own urine is probably a good baseline just to see where we are at, like, on a daily basis. And then knowing that, hey, if it takes 4 water bottles a day, 64 ounces a day for me on a regular day to keep my urine at that light lemonade color, if I were to work out and I sweat a lot, I probably am going to need a lot more than that 4 bottles a day. And so kind of gauge that way according to your needs and your body.
Right. Thank you. All right. Well, thank you both. This has been very informative and hopefully helpful to our patients because it is important to exercise throughout the year. I know we're getting into spring, hopefully very soon, and everyone will want to get outside and be more active. So we look forward to seeing you back here next month. Again, we are here on the second Friday of each month for the wellness webinar and hope you all enjoy your weekend. Thank you.